These people should stay. If you found something that works in your life, in any area of your life, please keep doing it. Like, of course, keep doing it. This conversation is for the hundreds of millions of people, however, who don't meet that criteria and are pretty sure that their diagnosis has been improper, they've been underdiagnosed or misdiagnosed or overdiagnosed or whatever they've been, and are now receiving a treatment that they know is not optimizing their life. That's what this conversation is about. And when we start looking at that, we start seeing that the people who have already decided there's something wrong with them are a much bigger challenge. Because if all we do is take away their medicine, all they want to know is, well, what am I going to take now? Because I obviously need fixing. I'm obviously damaged goods. Unlike the people who are thinking about coming into the system, who think there's something wrong with them and they've been given a recommendation to go get some professional help. And these people maybe haven't yet crossed that starting line, you know? Those people, it's easy to actually have a conversation with them and let them know that they indeed have nothing wrong with them. It's much easier because they, in fact, haven't already committed themselves to the notion that they're damaged goods. Now, the truth is, even the people who have committed that they're damaged goods might learn, like 20-somethings, they're very easy, or not very easy, but this is a group that is actually easier to work with because most of them have been pushed into therapy by adults older than them, and they have never bought the bullet. They're just doing what they're told, and they know that it's wrong, that they're wrong, you know, that they're not wrong. They already know that. So when I come around them, they're eager to relearn that there was nothing wrong with them in the first place, and that's a different group as well. But the older group, or the group that has been on medicine for a while and been counting on being fixed or repaired or, you know, like upgraded or something, that group is a little more difficult to convince as the undoctor.
Now, so on that, I mean, there's some nuances there, and I'm glad you gave us that disclaimer. You know, one of my monikers is where East meets West naturally. And you know, earlier on in my career, I was anti-drug, and I'm full on, that was one of my biases. And I'm still lean that way as a natural therapeutics, naturopathic doctor, Chinese medicine practitioner. But do you feel like there is a role for medications in psychiatric treatment?
I get asked this question enough times that I have a few different ways of answering it. And the answer is, the only time I will prescribe medicine is if someone's already on it and is telling me that it's helping.
Okay.
So there's that role.
Yeah. So, you know, we have this mental health crisis, and we're seeing an enormous amount of prescriptions being for anxiolytics and depressive medications. And you know, you gave us that lovely quote of being well adjusted to an ill world is not healthy. And so that aspect of having the discomfort, having those conversations, and transforming the way you look at your suffering or your symptoms is a big piece. So again, we're not saying do not stop your medications if you're on medications. And if they've given you some relief and kept your head above the water, by all means, stay there and get into this conversation around, can we get underlying to the root causes and really explore in a human way. You know, one of those definitions of healing is to witness and empathize with love another's suffering and just being present in it.